Well, good afternoon, and thank you for joining the Flint Community Webinar on Coronavirus. We are now week 121. Excuse me, wow, 101. Well, I've jumped way out there, but we want to appreciate you for joining us today. My name is Yvonne Lewis, and I'm the moderator for today. And I want you to know that this session is being brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. These are community academic partnerships that have come together to help bring credible information to our community, particularly in the midst of a global pandemic. Our goal with this webinar is to ensure that we're bringing information to you that is usable right now. What are the resources and services that are available? How do we access them? And then how do we get a better understanding about what's going on in the world of COVID as it relates to all the other things that are happening in our community as well. So again, let me thank you for joining us. We have an amazing array of partners that continue to join us every week that will help us to share with you these really important insights. So we've talked to you about this array of partners, and I'm excited that we're continuing to identify individuals from various organizations across the state and particularly in our community who have taken the time to spend this hour with us every Friday from 12 noon to 1 o'clock to make this information available. I want to thank those of you who are sharing this information with others. Right now, I'm going to ask you if you're on Facebook, please let us know you're there, but send a note to someone else that you might know to join us on Facebook or also to join us actually in the webinar today. We would love to have you. Reminder to put your questions in the Q&A. We've got some great questions over the weeks from all of you, and so we want to continue to have that input from you because it's your input that helps us to make the difference. So again, let me let you know today what we're covering. Of course, we're going to deal with some coronavirus issues because this is the Flint Community Webinar on COVID-19. But it is expanding. There's this notion about of things changing, a phase two. We want to talk a little bit about what we mean by phase two and trending down. When we talk about trending down today, we'll focus in on it's more than just the numbers, that the numbers of COVID are going down, but there are other things that are incredibly important for us to think about that are going down as well. Today, we're going to provide for you a little bit more than just a medical moment. We're going to have a medical segment today. Dr. Susan Wolford is going to give us that medical segment. And then, as always, we're going to encourage us to follow the public health protocols. And this is an effort to avoid future surges. So, again, let me thank you for those of you. I'm going to remind you up front, those of you that are social workers or community health workers, and you're looking to get those social work credits, please stay on with us for the entire webinar. And then once you close out of the webinar today, you'll get that survey that pops up. And we want you to make sure that you indicate whether you're a community health worker or social worker. Fill out that survey in order to be eligible for those credits. So thank you for that today. I want to move into our roundtable discussion today because this is Black History Month, and African American history is really important because African American history truly is American history. But this month has been set aside to look deeply into some of the experiences and the history of African Americans in the nation. And I particularly today want to point out and focus on a couple of our local credible persons. One of the things I'd like to point out today is many of you may not know right here, T. Wendell Williams. I want to highlight him for a moment. T. Wendell Williams was the first African American male to serve on the Flint Community School Board. Many of us may not know that we have had a school named after T. Wendell Williams. There is a health office clinic down the street on North Saginaw Street named after him. And he is also the father was also the father of the first African American female mayor in the city of Flint, former Mayor Karen Williams Weaver. And I raise that as him being a pediatrician because we have one of our own here in the webinar today, who is also a pediatrician, Dr. Lawrence Reynolds. But as I speak about mayors, I want to take a pause because on the other day we learned that we lost another individual that was prominent in our community, the former Mayor Woodrow Stanley. passed away on Tuesday here in the city of Flint. And we do want to give a moment to just appreciate that legacy that he left and the important work that he did as and also an African American mayor in the city of Flint. So let me take this moment, Dr. Reynolds. I have a daunting challenge for you today. Dr. Reynolds,
Mhm.
I consider him to be a living legend, one who is present with us in the community, and sometimes we forget to appreciate. But Dr. Reynolds also a pediatrician. He is a graduate of one of the HBCUs that I'll let him tell us about in a moment. And he is also the former CEO of Mott Children's Health Center. Dr. Reynolds has been on the forefront of helping to help us understand the issues around the safety of water for particularly our children in the Flint water crisis. And he continues that he served on the governor's commission, and you'll give us the right name for that. He served on that commission, but he has been an avid voice. I'm so excited that you've been able to join us for so many weeks. And the other thing is, when we heard last week before last from the superintendent of schools that our children will have the hydration stations in the schools so that they can have safe water. I know you had a lot to do with that. There's one other link we want to make, Dr. Reynolds, and that's to the U.S. syphilis study at Tuskegee. And I'm just going to let you roll with that and tell us how that relates to what we're experiencing here in the world of COVID.
Okay, remember to give me the cutoff sign. Uh, yes, I am a graduate of Howard University College of Medicine, which was started uh, shortly after the Civil War in the freedmen's camps that were in Northern Virginia. And that was where formerly enslaved Africans moved north for safety and for service and medical services also. What many people do not know is there was a smallpox epidemic that was roaring after the Civil War. And part of the job there was for the Freedmen's Bureau to treat uh, formerly enslaved folks. And there was a lot of talk about freemen could not survive without being enslaved, and maybe we should just let them die. And that was from both the North and the South, let me be clear, in 1867. You've heard me say before, my mother is a graduate of Lincoln School for Nursing, which was opened initially as a old folks home for formerly enslaved in New York State when they were doing gradual emancipation in the 1830s. It later became a nursing school for Black nurses and provided staff for the Lincoln Hospital in the Bronx, New York, which served primarily people of color. So I bring these things up so you understand I'm not talking about things that happened thousands of years ago. Some of us have lived through this as children and as young adults. So I started medical school in 1974. This was a year after the Tuskegee syphilis study blew up. Okay. And what happened? Well, in 1932, 600 Black men were part of a study where about 300 of them had syphilis and 300 did not. They were the control group, and they were watched for decades to see how syphilis manifested over the years in Black men. Now, it was later in the 1940s that penicillin was widely available to treat people for syphilis successfully. However, they were not informed of the availability of that treatment, nor were they offered that treatment. So some of these 300 men died of the long-term effects of syphilis, and it affects the bones, the eyes, the nervous system, the brain. It's a devastating condition, and even worse, the men could pass the condition on to their wives, their partners, and therefore it could be passed on to their children in the form of congenital syphilis. So this was horrific, and it was not disclosed until 1972. in an Associated Press article. The study was not stopped until the early 70s, officially stopped. Uh, it was just horrific. And the US government did agree to provide medical services for the families and the participants. And finally, in 1997, President Bill Clinton offered an official apology. So, you know, for me, 1997 is the middle of my life. For some of our young listeners, this is ancient history. But what I tell you, I present this so you know, many of us have lived through these experiences, and it has made people very cautious about participating in studies. Okay, so here we come to the vaccine. The vaccine has been studied. There are now processes in place where there's different levels of testing and assessment to assure safety and effectiveness. And this was done for our COVID-19 vaccine. And so we still learn more and more every day. And that's why we have the vaccine adverse event reporting system, so that anybody who has been vaccinated, who experiences what they think may be related to the vaccine, can report it. And then there are investigations. And notice I said anybody can report those things. So there are now safeguards set up. But I have to digress and say, you know, unless you're funded by the federal government, or you're in a research center that has what we call an institutional review board to make sure you adhere to these policies and practices, there are situations where organizations and companies can set up their own independent research work without meeting these qualifications. And at another time, I can go into more detail about those compromises of ethics.
Thank you, Dr. Reynolds, for that summary. We wanted to bring that forward because, as you know, the Healthy Flint Research Coordinating Center, those organizations I mentioned, the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center are all organizations that are community academic partnerships between these institutions, our universities, Michigan State University and the University of Michigan, to ensure that we have community engagement. And we talk about the data, and it's good to see Dr. Deborah with us. We talk about the data, but the data is only as good as what's input there. And so if we're not participating, and I appreciate you saying there were times we were not asked, now we have opportunity. So we want to encourage you, when these opportunities are available, be a part of them, because you can ask the necessary questions and encourage appropriate research that will make a difference in our community, because your voice does count. Dr. Reynolds, you mentioned the study. There were some things that were put in place, like the Institutional Review Board, to look at these and other things that are put in place as a result of that horrific experience. And now we have the opportunity to have ongoing voices in these experiences. So I want to thank you, Dr. Reynolds, for laying that foundation for us, because now we're going to talk a little bit about it. I want to ask Katie, when we're talking about trending down, we also know that as a result of where we are right now, the cases are trending down. We will hear some of that data in a moment. But Katie, how are we doing as it relates to mental health?
Well, I would say that it will take some time. I think we are hopeful, cautiously optimistic about things are going a good direction. But as far as mental health, people are still really impacted by the effects of COVID-19. People are still dealing with loss, illness. Some people have extended illness. And I've even read recently that individuals who have never sought services once they've developed COVID-19 are now seeking mental health services because it's affected their anxiety, depression, things like that. So we also have a lot of children still seeking services, high numbers of children. The pandemic has been really difficult on children particularly. Loss, grief, isolation, fear, worry, uncertainty. So it's been a very difficult time. The good news is we do have lots of services, a lot of supports available. So people, it's really important that we utilize and reach out and get the help when we're struggling. It's okay to ask for help.
Thank you, Katie. So while we're asking for help, I want to go to Dr. Deborah as we're talking about trending down. I've told you in some of our conversations, because you hear all of my real serious concerns before we get here, but I've told you I've been real concerned about this conversation about things that are trending down. It seems like it's making it getting us to the point where we should be okay and comfortable with COVID now, because it's been around for a while. It's not going away. Just relax. And so cases are trending down, but does that mean we just need to take our foot off the gas?
Well, so I would say no. And here's why I would say that, because, we're learning about how this virus is going to move through our population. It hasn't followed some of the kind of typical patterns that we would think about, but there are some things that are pretty consistent, right? So just like with flu, there's like a flu season. We can predict that, likely there will be a COVID season. So like last year, we saw lows in the summertime, and then we got this Delta variant that emerged, and then we got a lot more cases. I do give people a little bit of caution, because when Omicron came, people kept talking about mild symptoms. And I just want to let people know, while the overall rate of death might have been lower with Omicron, the absolute total numbers were way bigger than they were with Delta. Why? Because we had so many more cases. And then even what people call mild symptoms, is somebody who had COVID and had Omicron, those symptoms were not mild for me. It wasn't like having a cold. I've never had a cold that knocked me off my feet where I would get winded or very tired going from my bed to the bathroom. And that's what my COVID experience was. The first few days, it was very difficult for me to breathe at night, and I was fully vaccinated. So my concern is, we have all of these great now protections and interventions in place. We have a safe and effective vaccine. We know a lot about it. We understand now the role of masking, and we've even elevated the type of mask that we know that we need. We need well-fitting, good filtering masks. And my concern is, as we peel back some of these layers in this rush to normalcy, we're not really also emphasizing these other things. So getting rid of masks with vaccination rates and now rates of people being boosted being so low, it does give me pause. I feel like we are potentially going to seed the next surge. So I still encourage people, if you're in, crowded indoor spaces, if you can avoid those, I would. I still choose to be masked. It doesn't matter what the law says. There's no law that prohibits me from masking. I still mask when I'm indoors and around others. I did get my 4 free tests from the feds. Yvonne, you and I ordered them on the same day. And it's funny because I ordered myself and my 2 children who live outside of the home, one who lives in Genesee County and one who lives in Baltimore. My daughter in Baltimore just got her test yesterday, and she ordered them the same day that we did. And she actually has a different set of tests than the ones that we got. We got the 2 double packs. She has a different type of test, and it's still an antigen test, and it's a 4-pack all in one. So I encourage people, get those resources and continue to utilize them. And still, the best layer of protection is this thing right here, our good old brains and our minds. And I encourage people to use your noodle, right? If you've been around somebody who's been exposed, whether or not somebody requires you to quarantine, you should consider that. Jordan heard me, so she brought her tests in. These were the 4 tests that she got, her at-home kit, and it's, not too much bigger than my hand. If you're traveling, take your test with you. Travel test before you go so you don't expose people, and then test when you come back. The mask is still a great line of defense. And then obviously, don't just get your vaccine, make sure you're fully vaccinated. And now to be fully vaccinated, you need your booster. So make sure that you get your booster, not just for you, but for you, for your household, and for your children. If we can keep these layers of protection in place, that's our best defense to keep this downward trend and keep these numbers flat. We could have a much more vibrant summer if people would do that.
So Dr. Deborah, in your conversation here, so what I hear is trending down, the numbers are trending down, but also when we look at our sites, we have fewer people going to get tested. Now you have their in-home tests, so fewer people are going to the sites to get tested. We see fewer people showing up at the vaccine sites to get vaccinated. So because we're sensing that this thing is getting better, we're now not doing the things that we talked about that helped us to get to hopefully this better state. So we have to keep this going, because getting to Katie's point here, where our children are being impacted, the thousands of children that have lost someone really significant in their life at such early ages, it's not like you're losing one or two people. We're losing them in like clusters.
Yeah.
So
thousands of children orphaned. Yeah. Thousands of children have been orphaned during COVID. And I don't, as a public health professional, the thing that I want to emphasize for people is those were preventable. So as people start to think about this new normal, and people really, and I understand this just missing life as we know it, wanting to have, summer barbecues and, the big gathering at auntie's house or grandma's house or, whatever, and all those things, just use the basic precautions that we have in place. And I still maintain our best line of defense is for everybody to get vaccinated and boosted. We know that won't necessarily prevent you entirely from becoming infected. It does reduce the risk of infection, but it is very good at reducing severe illness. And I think that's important because there was a period in December where we were averaging 2,500 deaths from COVID in the US per day. 2,500 preventable deaths per day. If you look at the average age of COVID hospitalization and death, it's actually gone down. So when it first started, we thought of it as a disease, and a killer of the elderly or people who were really sick. And lo and behold, that was very true early on. It evolved. And now the average age of hospitalization and death have gone down, and it has affected much younger populations. And we've also had way more than a trivial number of pediatric hospitalizations and deaths from COVID. So yeah, like I'm with everybody else. I'm sort of over COVID, but I also remind people that COVID is not over us. So we should really practice some of these, very good basic prevention practices while we can. And the work that we'll be doing through our N-Nice initiative and some other things will be super important, because we're trying to really put tools in the hands of local grassroots community organizations and organizations that are already serving people and already meeting people where they are. We cannot take our foot off of the gas with these vaccination efforts. The vaccine, just like the flu vaccine and all these other vaccines that have prevented so much unnecessary death and disability, will be important for us to get that fully activated, especially as we start to peel back some of these other layers like mask mandates and kids going back to school and they're not just going back to school, they're in full engagement. They're back in after school activities, they're back in sports. And we know that that's what serves kids, but we also know that vaccines serve kids, and vaccines have saved more lives than almost every other public health intervention today. It's like up there with seatbelts.
Right. So we'll have to get into that whole vaccine conversation where we can really tease that out, looking at the historical benefit of vaccination. So thank you for that, Dr. Deborah. And I know we could go on. I see Dr. Reynolds' hand, and then Katie, I'm going to ask you if you would just for us today, because of this increase and the impact on our children, and give us the number to the Genesee Health System so people know that number and they can call that number, and we'll have Dr. Reynolds come and respond.
The number is 810-257-3740. 24 hours a day, 7 days of the week, 365 days of the year.
Thank you, Katie. Dr. Reynolds.
Yes, this ties up both conversations because we're talking about COVID and the mental health issues. The most recent report is there have been more than 200,000 COVID orphans. That means children who have lost their primary caregivers that we know of now, lost due to death. So the majority are in communities of color. So we have to look out for each other.
Thank you, Dr. Reynolds. As we round this roundtable out, it is really something for us to think about. History is important, and we're going to talk more about just some of the historical factors as we move forward in the webinars in the coming weeks. But we also want to look at current data. So what does it tell us? I'm going to go to our next slide here, looking at and Mary Catherine Crawford's going to tell us a little bit about where we are in the case rates by case numbers by race.
Yeah, hi Yvonne. It's so good to be back. I know it's been a couple weeks, so let's just kick off. So new confirmed cases are again lower than they were last week. So if we look at the numbers, there were about 500 confirmed cases in Genesee County and roughly 80 confirmed cases in Flint. So I want to point out that the last time we did see numbers like this was more than 4 months ago in early September. So as wonderful as this is, I do just kind of want to echo what Dr. Verholden was saying about being very cautious and maintaining good public health practices, because I think we need to be careful about interpreting too much of this downward trend as testing rates are changing. And we also need to bear in mind that this data doesn't consider other factors like increased availability and use of at-home testing kits. And then we're also going to see variability related to inequities in vaccination rates. So it doesn't mean that variants are impossible or another surge can't happen. So again, it's good news for now. We should remain optimistic, but not celebrate too early. And then as far as the state's positivity rate go and the county's positivity rate, we are in Genesee County still hovering over the state's rate of about 9.8%. We're at about 12.6%. So we're definitely going in the right direction. We just need to keep that momentum up.
And Mary Catherine, I don't know if you have the answer to this because we didn't check in earlier on this, but where do we want to be as it relates? You said we're a little bit ahead of the state, we're at 9%, but where do we want to be as it relates to our case numbers?
Well, as it relates to positivity rate, we definitely want to be back below that 5% number, which we haven't been there. And I can't even tell you the last time we were below 5%, but we want to keep, hopefully we'll keep getting lower and lower as the weeks continue.
Thank you. So again, one thing that we want to encourage us all to do is, even if you are testing at home, if you test positive, please report those positive tests to the health department. They still need to have that information so our data is correct. Remember, our data is only as good as the information that we put in, and you are a critical piece to that. So please help us in that way. Thank you, Mary Catherine. Dr. Susan Wolford, you've got a lot to tell us today as it relates to what's going on with this trending and the numbers and the cases and where we're going potentially for another surge. We're just going to give you time to just give us, so it's more than a medical moment today, it's a medical segment. So Dr. Wolford.
All righty. Well, thank you so much, Yvonne, for this more than a medical moment, because you've given me extra time, which is always wonderful. I'm still going to set my stopwatch here so that I hopefully won't go too long. And but it's even more than a medical moment and more than a medical segment. In honor of Black History Month, I'm making it a little bit of a musical medical moment. And no, I will not be singing, just in case anybody was wondering. But we're going to be learning from the past, and it will be preparing us for the future. And so with that in mind, I am going to try to be here. Many of you will be familiar with this song, the Lift Every Voice and Sing, which is I'm playing in honor of Black History Month. And just as a segue, this arrangement is played by Jonathan Wolford Hunt, my nephew. You know, I love to play his music. But why I'm playing it is because I want us to focus on this part of the song. It says, sing a song full of the faith that the past has taught us. Sing a song full of the hope that the present has brought us. all of that gets us to the point where we are hopefully facing the rising sun of a new day begun, and we're able to march on until victory is won. And so when we look at those, think about those words, let's think about the first part. What has the dark past taught us? So this is a graph of deaths from coronavirus in Michigan over time. And you see that first spike in spring of 2020, where we were all first became aware of this virus. It was alarming, quite rightly, and we all put in place a number of mitigation practices. We learned that washing our hands was far more important than we'd ever knew it was. We realized that we had to put that physical distance between people that we were not living in the same household with, and that masks at first, which had to be saved because they were so precious and we had to save them for frontline providers and frontline workers, but they would help protect us. And so many put these things into place, and we were able to see that that spike go down. And we were like, yay, it's going away. We're flattening the curve. All our hard work is coming into effect. And then by the end of that year, we had another even bigger spike. And we thought, oh my word, this is even worse. By this point, we've learned some things. We knew that one of the problems with this virus is that it will cause our bodies to overreact to the infection and end up having this cytokine storm. And one of the things that could help us deal with that was using a very common, very cheap steroid. So that became part of our treatment protocol. And then we also had a new antiviral drug, remdesivir, which could be used in the hospital to help prevent that virus from replicating. And we also first learned about monoclonal antibodies. Now, these have been used for years in other circumstances, but here, the antibodies that we needed to fight this particular virus were being created and available, even though in limited quantities, to be able to give us a jump start on fighting that virus, because at that point, we didn't have the vaccine. But we saw that these things could help us. And we also saw that in the winter, when we all sort of gathered together, more indoors, less outdoor activities, this virus was able to and would spike again. And then, praise the Lord, we saw it come down. It came down at a time when we also saw that we had the vaccine. And we had great hope at that point, because we were like, we have an effective vaccine. We have 2 effective vaccines, and another one was on the way. We had vaccines that would work, and we were convinced people would take the vaccine. This would help us get out of the pandemic. Okay. And then many of us, for the first time, learned about variants. Unfortunately, from England, I'm sad to say, but there came this alpha variant. And we learned that the virus has if it can get into us and live in us for a while, it has the opportunity to mutate and come out, sometimes weaker, sometimes not, but on occasion, it comes out stronger with more ability to get into us or give more severe illness. It changes, and that mutation happens when it gets to stay in us. And so we also learned that the best way to avoid these variants is to get vaccinated, wear a mask, so that it can't stay in us and replicate. So we came out of that spike, and we thought a little more cautiously now that, okay, that spike is gone, but what's going to happen next? We're going into winter. And yep, here we were coming again. We're in closed environments more. Delta was on its way. And not only did we have to deal with the Delta variant, but then we had to deal with the Omicron variant on top of all of that. And so we saw the expected spike after the holidays where people gathered together and traveled more, and somehow we let our defenses down a little bit. And then of course, there were these more contagious variants around. There was a glimmer of hope. We had the now oral medication, Paxlovid, which came out, and another one from Merck that could help us fight the infection off. And so now we see that the virus, the number of cases is going down significantly, and the number of deaths in Michigan starting to decrease. So that can give us a bit of hope. But we have to learn, if we look back over this graph and over our experience, we see that this waxes and wanes. So what do we do to really be able to live in this hope that maybe things might be getting a bit better? So for that, I want to go to a favorite quote, proverb of mine, and it says, "Go to the ant, consider her ways, and be wise, which having no guide, overseer, or ruler, i.e. without people making her do this, she prepares her bread in the summer and gathers her food in the harvest." So what does that mean for us? How can we be wise now? So as Dr. Verhulden said, even if somebody doesn't make us isolate, if we know that we have been exposed and we are likely to have been infected, then we need to quarantine, and then we know we're infected, we need to isolate, we need to do those things. We need to wear our masks when we know that we're at increased risk of being exposed, and to protect others. And we need to be sure that we are vaccinated. Those are the best things that we can do. There is another thing I'd like to say that we could do that would help us as we think about being wise in this moment where we're getting a little bit of mental relief, right? We're not quite as stressed out by this because the numbers are trending in the right direction. So let's use that energy that we have to think about 7 things that will help us to be prepared when the next wave comes. Because what we know is that we have to take the vaccine, wear the mask, do all those things that we've been talking about. And we need to be in the best health possible to give our immune system the best chance possible to fight this off. So I'm going to give you 7 things that are going to help us with this. As you know, I have to go to the kitchen. So number 1 is our nutrition. Think about it. Increase the fiber in your diet. And I'm not saying that everybody has to go out and just eat celery, although it's not a bad thing to add to your salad. But think about the amount of fiber in your diet. When you go and buy food, buy things that, if it can have fiber, has 3 grams of fiber or more per serving. That will help, because fiber helps to control the hormones in our bodies, helps to regulate the action of our adipose cells. And if you look back at our previous webinars, you'll see I have a lot to say about how adiposity has worsened the impact of COVID for many of us and the ways in which we can help to avoid that problem. Okay, so 1 is nutrition. 2 is exercise. Exercise helps our immune system immensely. And all of us are sitting at our desks much more, or many of us are sitting at our desks much more than we were before. But that doesn't mean that we cannot be active, because one can be exercising while one is sitting at the desk. So for example, I'll show you, I have on my desk here a system that allows me to work those arms out so that there's exercise there. And if that isn't enough, I'm going to show you a little bit more of the under the table, what's going on. So I have an under the desk exerciser so that while sitting, I can also be pedaling, right? I mean, we all know you only have to dress the top half of us I made sure not to not to have on just the sweatpants for the after, but I put on the regular trousers. But yes, we can do that while we are building it. We have to build it into our day. The recommendation is 150 minutes of exercise every week. Are you doing 150 minutes of exercise every week? If not, try to build up to that. Okay, number 3, water. One of the best things that we can do for both our immune system and an overall health. Have it at hand all the time. Next thing, sunlight. Sorry, couldn't bring the sun in to show you, but one of the big benefits of sunlight is its impact on vitamin D. And here's my vitamin D3 that I have been taking because I found that my vitamin D level was low. And the important thing here is that there are studies exploring the impact of vitamin D and our ability to fight off COVID. And while they are still in progress and there isn't a definitive answer, it does seem that if you get COVID and then start taking vitamin D, it doesn't really do much. But if you go into your infection with the normal level, with the appropriate level of vitamin D in your system, then you are better able to fight off the infection should you have it. So if you can't get out in the sunlight, that's the best. But if you can't, take your vitamin D orally. Okay, and then the next thing is moderation. And in fact, really elimination of certain things. If you smoke, think about not doing that. Obviously, that worsens the impact of COVID if the lungs are already damaged. If you drink alcohol, think about decreasing that because that has a negative effect. Excess amounts of alcohol have a negative effect on our health and particularly on our weight. And as we mentioned, that adiposity is a problem when it relates to COVID. The next one is fresh air. We want to be sure that you get out, get fresh air. Now people say, well, I have to wear my mask, but there are places outside when there are no other people around, you can go out without your mask. And even if you go out with your mask, you are still getting fresh air. And we can do that again. We can do our demonstration. If you look back at one of our previous sessions, you will see that the air, the oxygen can get through our masks very, very well, even though the virus can't get through the mask in the same way. Okay, then number 6 is going to be sleep. You don't necessarily have to put on your iPad to go to sleep, but do get the appropriate amount of sleep. Less than 6 hours a night increases the likelihood of having excess weight. So if you are not getting more than 6 hours a night of sleep, think about how you can change that because that will impact your immunity as well. And finally, stress reduction. People know what is best for themselves, what brings them less stress, if it's listening to music, if it's reading particular books, if it's whatever it is for you that decreases your stress. It's okay to take that self-time and that self-care. That is what we need to do at this point to look after our health. And so with that in mind, I think those are ways that we can be wise and prepare for our next, what we can imagine will be our next wave. We know that this is not going away right away. We know that we have probably a long time in the future where we'll have to work out how we deal with COVID and how we're able to protect ourselves and our family. But now we've learned so much through the past that I am convinced we will be able ultimately to march on until victory is won.
Well, thank you, Dr. Wolford. All right, you took us to a whole lot of places in your kitchen and in your medicine cabinet today. So we appreciate knowing that there are some steps that we can definitely take that will help us to get beyond our challenge here. I'm struggling because it isn't get beyond the challenge. How we will prepare for what may be coming. We don't want to see another surge, but if we don't follow the protocols, if we're not wise and be mindful, we could definitely see an upsurge. You showed us those different spikes. So thank you so much for those medical moments, that segment. Thank you. And as we move, there's some other things that are happening in our community. Kiana Towns from the city of Flint is here with us today. She's a manager of public health for the city of Flint. And I know that the city of Flint is working on some things to try to help us address some of these issues. So Kiana, can you give us the insights today from the city of Flint?
Absolutely. Good afternoon, everybody. I just wanted to first confess to Dr. Wolford that I'm not getting my 150 minutes, but I'm going to do better. I'm going to find a way to get my under the desk paddle and get to work. Here are the few updates that I have here from the city of Flint. One of the first things that I wanted to mention was that our vaccination clinic for today, which was held at the Dort Mall, some of us might know it as the small mall, we had to cancel today due to weather as the staff was not able to travel. So we will resume on Monday at Hasselbring at 10 a.m. So there isn't anyone there today. So sorry for the short notice if you weren't able to see that on the socials, but we'll be back on Monday. The mayor of the city of Flint held the first input sessions last night for the ARPA funds. That meeting was held at the event center at Mott Community College. There was a fairly good turnout from the community there, in person and virtual. Just want to remind everyone that the next meeting is happening on February 22nd at Sylvester Room at 6 o'clock. If you are not able to come in person, you are more than welcome to join online, Facebook Live. The meetings are also archived, so you're able to go back and watch them. So the best way for us to stay informed is to be present during these events. So if you are able to join in person and would like to, we'll see you on the 22nd there at Sylvester Room. The city of Flint is featuring on its social media pages this month Black-owned businesses during Black History Month. And so if you are all on the socials, if you're on Facebook, if you're on Instagram, if you could check out the City of Flint's websites, there were multiple businesses featured just this week, catering businesses, accounting businesses, across the spectrum. Really, really excited to see those Black businesses being promoted and hoping that our community will then go and support those businesses. So check them out on the socials. And then just one last thing, if you might indulge me, my daughter is out of school for the first time and is able to watch me today. She is turning 13 this weekend. She's a 9th grader at Genesee STEM. And so I will say, Glitter Fox, happy birthday, love. I love you more than ice cream.
Well, now you started a trend here. I won't be surprised. We're gonna have some other sneaking in birthday greetings, but thank you for sharing that with us for what's happening at the city. And I'm glad to know that a 13-year-old is watching our webinar. So it helps us to understand. We'd like to get some feedback from that young 13-year-old as to whether or not this has been beneficial to her. And let's see how we can make sure when they have opportunities, we're making this relevant to them as well. Thank you, Kiana.
Oh, you're welcome.
One of the things we want to point out today is that we are very fortunate in the city of Flint. Our representatives from the Genesee Health Department are not here with us today, but I am going to ask Dr. Deborah if she would come back and share in this next segment with me, because I think we're very fortunate here in the city of Flint, Genesee County, to have the number of sites that we have for vaccination and testing. You've been all over this country. You've talked to people all over the country, Dr. Deb. Our other communities, especially as it relates to disparities and access, are they experiencing the same thing that we have here?
Yeah, so that's a really great question. And I'd like to point out for people, I think what we have both in the state of Michigan, and if you drill down even further in Genesee County and in the city of Flint, is unparalleled. They do not have the same robust systems for testing and vaccination that we have. Literally now, when we were in this height of this surge, you could still show up without an appointment and get testing, but you would predictably have to wait. I did check it out myself, and you were still able to go on, and I might have had to check multiple places, but mind you, we've got one-stop shopping. You go to one website to book a appointment at the 3 state-sponsored sites that are at the 3 churches. And you can not only get antigen testing, but you can also get PCR testing. And it's important because different places have different requirements. So if you want to get on a plane for an international flight, as an example, you might be required to have a PCR test, depending on which country you're going to, or depending on which country you're coming from when you're coming back into the US. My point is, we just have a lot of resource available. The grain of salt that Mary Catherine so brilliantly pointed to is the numbers are, in reality going down, but we will have a counting problem in that, because so many people are using at-home testing, and all of those people might not be reporting those results to the health department. And there is a system in place for people to be able to do that. It's possible that we might have some undercounting that's being contributed to by that. But what a great resource and a great blessing that people have that tool right in their hands and are able to do that at home. So I just want to lift up again our vaccination sites. We've got ongoing access to vaccine for many of these places. Again, you can just show up. You don't have to, have an appointment. So I really encourage people, if you're still on the fence, if you've got questions, we're seeing that the booster rate is still like below 30%. If you're questioning whether or not you need your booster, don't question any longer. Go and get your booster at any one of these pop-up sites. And please, please do continue to access that testing. Us understanding spread in our community relies on people continuing to get tested, right? If people are only getting tested if they have symptoms or if they have a known exposure, then it will look like we have a lot less COVID in the community than we actually have. So these 3 sites, and I've been to all of them, they're wonderful. We're sort of out of that period of high demand. So, I know people like you, Yvonne, were getting regularly tested, right? You took Dr. Reynolds' advice and practiced cadence testing, which is, hey, I'm going to work, multiple times a week, maybe even if not 5, but if you're going into an office 3 or 4 times a week, it's important to get tested regularly. Why? Because the earlier you identify yourself as a case, the better actions you can take to protect yourself and others. I just had a conversation with a woman this morning who they had their grandkids with them right after Christmas. And then right after the grandkids left, her and her husband went to New Mexico. They got a call the day they got to New Mexico that one of the grandkids had COVID. And they immediately started masking up. They had a terrible time in New Mexico getting access to a test. Took 2 days. So it really changed their trip. And in fact, the husband did end up having COVID and the wife was COVID negative, and she was able to stay COVID negative. And they had to drive home from New Mexico back to Virginia because they were not able to get on an airplane. But the hardest problem that they had was getting a test for him in that community that would clear him so he could fly or give him that information that he needed to know whether or not he had COVID. So again, utilize our testing and vaccine sites. We've got the 3 sites that were just up, and then we've got these additional testing and vaccination sites all throughout the city. And I just want to salute our fabulous health department, our state department of health and human services, and the city of Flint, who have done, just to me, an outstanding job of making sure that these resources are widely available in community, from the work of the city of Flint and getting it at many stations, to the work of the health department and having all these sites, the partnerships with the big places like Walgreens and Rite Aid and Meijer. We've got a lot more than a lot of other communities have.
Yeah, and this is all stood up because our community voices, yours in particular, Dr. Deborah, and so many others have said, and even some of our pastors have said, we want to make sure that our community has access. So we're addressing this whole issue of disparities, where at one point, there was a difference in where we could access. But as you've looked at our webinar each week and you go on the site, there is now testing and vaccines available in most of these sites. So you can get it all done at one place. And so it's really important that we utilize these sites. So thank you for sharing that, Dr. Deborah. We have one more thing. And I saw Joanne Herman, if you need additional support, the health department is willing to come to you all you need to do is call them at 810-344-4800. And Joanne has told us about, they've gone to people's homes. They've done it, on the street. So Joanne, we've got just got a minute to give us that plug of how people who really can't get to these sites can get support from the health department with your program.
Sure. Thank you, Yvonne. Yes, we are going to homes to vaccinate first, second, third booster doses. We are doing it for homebound people, and we have a team of physicians, we have nurses that are going to the homes and really helping those that are vulnerable and hard to reach population. So we are working away. We're doing all the different vaccines available, and whatever we're just following the timeline. So we've been very successful. Probably our biggest barrier is people not being aware. So as Yvonne mentioned before, you can call the call center and get an appointment scheduled. So thank you.
Thank you, Joanne. And you're working along with some of our other partners. And I just want to give our shout out to, we heard from them last week too, Michigan United and some of our other programs, our community. We're working as a collective community. And this is really exciting because we're really trying to work together to make sure our community is serviced. And even one additional thing for a site, Ashley Home Stores, the furniture store, they looked out and said, we want to be a part of what's happening in our community to ensure testing. So we wanted to make you aware today that also in the front of Ashley Home Store in their parking lot, there is a drive-through testing Monday through Friday, 9:30 to 6. They are asking you to pre-register, and you can go on their site and pre-register, or you can call them at 248-781-8318. For those of you that are listening and you can't see the slide, it's right in front of Ashley's Home Store in their parking lot at 3250 South Linden Road, 8 a.m. to 12 on Saturday. So if you missed today, can't get there before 6 today. Today they're only going to be there till 5 o'clock. But if you want tomorrow, they're there from 8 to noon. Register by going on their site, biocovidclinic.com/Flint/ or call them at 248-781-8318. Working together to make sure we have access to these services. As we round out our session today, we want to remind you to register for upcoming webinars. Excited that we've had organizations call and say, how can we get this in our newsletter? How can we make sure our staff knows about the webinar? You can register for upcoming webinars and watch the previous webinars by going to hfrcc.org. Go to that website and you can register. Just look there, scroll down, click, fill in the information. And once you register, you'll continue to get information about this webinar. Also want to give a shout out to our friend from last week, Mildred Hunter, who is helping us get the word out as well. Thank you, Mildred, for all that you're doing to help us to get folks registered. I got a call, an email, even from somebody in Chicago now who is looking at our webinar. So you can see the current webinar or watch the previous webinars as well. We also want to remind you, for those of you that are social workers and for those of you that are community health workers, this segment I'm talking about right now is so incredibly important because it is at your request that we were able, for the continuing education units for community health workers, to work with the MISHWA, which is the Michigan Community Health Workers Association, to get this certified so that you could get 1 CEU for every webinar that you attend. You can go on our YouTube channel and watch them. Please make sure you stay on immediately following the webinar when you close it out so that you can sign up for those continuing education units. The same for our social workers. Those contact hours, it's because of your request. We were able to partner with Michigan State University's School of Social Work to provide the contact hours. So we want you to get them. We're going to have a little session in a couple of weeks that'll help you really walk through it more carefully. But please take your time, stay on a couple minutes after you sign off and get to the survey so that you can get your eligibility included for the contact hours and the social work credits. It's been a wonderful webinar. Thank you to all of those of you that came to join us today, and particularly for those of you that put questions in. I hope we've answered all those questions for you today. And for our presenters, we thank you so much. So for those of you that are listening, please continue to like us on Facebook, subscribe to the YouTube channel, Healthy Flint, and email us with your questions at info@hfrcc.org. Always feel free to call us at 810-835-2130. And guess what? We'll be right here next Friday. So we'll invite you to join us for 102 for the Flint Community Webinar on coronavirus. Thank you for joining us today, and we'll look forward to seeing you next week.